Hello, welcome back. Welcome to the continuing video series on Attention Deficit Hyperactivity Disorder, brought to you by Megatech Incorporated. Megatech Incorporated provides technological treatments for persons with attention deficit hyperactivity disorder. Megatech Incorporated are makers of the attention deficit hyperactivity treatment game called Cups and Balls. Please refer to the attentiondeficitdisordergame.com for your free use of the game. This game provides therapeutic benefit for the enhancement of a person's ability to focus and attend. In this session, we'll look at what is the assessment procedure for attention deficit hyperactivity disorder? What is the assessment process for diagnosing someone with ADHD? How do I know if my child actually has ADHD? Attention deficit hyperactivity disorder is not diagnosed with an absolute medical procedure. There are no blood tests, there's no x-rays, or brain scan imaging provides information on how the brain operates, but doesn't quite provide diagnostic information, especially for things like attention deficit hyperactivity disorder. There are no hard diagnostic tools for determining the absolute diagnosis of attention deficit hyperactivity disorder. ADHD is more of what we refer to as a syndrome. A syndrome is a list of behavioral criteria that we saw in the first training video series of this series. If a person fits enough of the criteria, and it is to the degree that it interferes in daily life and living, the person would then be given the diagnosis of attention deficit hyperactivity disorder. We look towards the professional. A professional in the field of ADHD can make the diagnosis. The professional has been trained to understand when to appropriately make such a diagnosis. Such professionals include the pediatrician, a psychiatrist, or even a psychologist. The tests that they use, these professionals will use client interview, direct behavioral observations in schools, at home, or in community settings. The professional would interview family and teachers and other persons involved in the life of such a client. Other assessment processes will use the collection of behavioral data. Behavioral data would be assembled and analyzed and looking for such patterns in ADHD behaviors. Such data includes school reports of trouble or out-of-seat behavior or any behavior that might be dysfunctional in the learning process at school or disruptive in the home environment. Pattern analysis will include frequency counts, durations, intensities of behavior, and the different settings and times that the behavior may have been exhibited. The intensity is typically measured on an intensity scale and can also indicate dangerous levels of behavior. Different instruments are used. There are many different psychological instruments used to assess attention deficit hyperactivity disorder. The most common one and often used is the Conners Attention Deficit Hyperactivity Scale. The Conners has a family report form and a teacher report form. These forms use the ADHD behavioral criteria and places each of these behaviors on an intensity measure of degree. The Conners and other similar scales measures the amount or degree of ADHD criteria features and behaviors. Other scales include such ADHD features to a more comprehensive assessment or of other possible diagnoses that it could attribute for. Some scales are able to distinguish ADHD from other similar conditions, maybe that of Asperger's syndrome or a conduct disorder. Tests that measure adaptive behavioral functioning also typically include a scale of ADHD behavioral criteria as well. Caution should be used when finding a professional in your area, professionals to assess and diagnose your child. It is important to find an experienced clinician who works with attention deficit hyperactivity disorder. However, if they work exclusively with ADHD, they may tend to only see all behavioral features as ADHD, when the behavior features may be attributed or associated with something different or other typical behaviors. Clinicians who work exclusively with ADHD sometimes are less objective and see only behavior through the lens of their ADHD predisposition. In the next session of this series, we will be looking at different diagnoses. Many psychiatric conditions, behavioral disorders, all share similar features. It's important to make an accurate diagnosis so that the treatment plan can be fitting for that person and not counterproductive to a missed diagnosis. On the other hand, since diagnosing ADHD is not an exact science, families should be patient while spending the time to get to know each client and the features that they have. Quite frankly, it's why we call it practicing medicine. There is quite a bit of trial and error associated with making a diagnosis, as well as finding the best and most fitting treatment plan and the success for each individual person. This concludes the assessment process. Thank you for your time and attention. Please visit the other companion trainings in this series on attention deficit hyperactivity disorder. In these, we will be covering the symptoms of ADHD, causes and how to diagnose and how to treat attention deficit hyperactivity disorder, understanding other coexisting conditions associated with ADHD. We'll also look at technological therapeutic games for the treatment of ADHD and the beneficial effects of cups and balls to persons with attention deficit hyperactivity disorder. Thank you for your time and attention. Please go to attentiondeficitdisordergame.com for your free use of this game. This game provides therapeutic benefit for the enhancement of a person's ability to focus and attend. Megatech is committed to the improvement of the quality of lives of persons with attention deficit hyperactivity. Megatech will continue to provide these technological therapeutic games free of charge to anyone and at all times. Thank you again.